Hello, everyone. My name is Suriya Vijayakumar.
And I'm Kaushik Burra, and we will be talking about global birth defects today.
Firstly, my name is Suriya, and I'm a rising senior at William Mason High School. I like to run cross country, and I'm very interested in chemical and biomedical engineering. In school, I'm a Mason Med Club enrichment officer, and I'm getting tested to become a nursing assistant at my local hospital.
I'm also a rising senior at William Mason High School, part of the HOSA team. I'm also being tested to become a nursing assistant at my local hospital. I'm the secretary of the medical club, education officer of Model UN, part of the LLS fundraising team, FBLA, and I love spending my time at my local temple teaching children. Along with that, I'm interested in biophysics and being part of biomedical engineering in my future. Have you guys ever had the thought of how many people in the world are born with birth defects? How many people have gone through abnormal developments and challenges throughout their life due to the fact that they weren't properly tested as a child while they were in the womb?
According to the Cleveland Clinic, birth defects are abnormal changes in the structure or function of a baby that occurs during fetal development. Despite being unnoticed, these defects have a profound impact, affecting over 6% of births worldwide in the last year alone. 7.9 million infants.
Furthermore, a study published in the British Medical Journal highlights a staggering fact: up to 85.3% of these cases are preventable. Even more concerning, approximately 94% of children born with birth defects are from low to medium income countries and families. This isn't just a healthcare issue, it's a crisis that demands our urgent attention and action.
As you examine the data on the left, it is clear that many low to medium income countries face significant challenges. Countries such as Sudan, Saudi Arabia, and Iraq rank prominently for their high prevalence of birth defects per 1,000 births. Additionally, this graph on the right shows the increasing global trends that birth defects have on infant children. Most notably, this red line isolates the number of infant deaths only due to birth defects, showing an obvious increasing trend between 1990 and 2010.
Now, let's delve into the components of this issue, starting with the genetic factors and challenges that they pose. Diagnostic procedures such as chorionic villus sampling, CVS, amniocentesis, and maternal blood screening are crucial for early detection in babies. However, these tests often require substantial financial resources and infrastructure to administer and interpret these results.
Unfortunately, these resources are scarce in many low to medium income countries. Local hospitals and birth facilities often struggle with limited budgets and shortage of trained medical professionals. This scarcity not only hampers access to vital prenatal screenings, but also deprives expected mothers of essential care and support during pregnancy. Moreover, many families are not even aware of these aids in pregnancy, further increasing the trends and prevalence of these defects.
Moving beyond genetic factors, environmental and behavioral influences also play a significant role in birth defects. Environmental factors such as access to clean water, hygiene practices, CO2 emissions, radiation exposure, and secondhand smoke can all contribute to the development of abnormalities in the fetuses due to the fact that there's harmful substances that are entering the baby and causing it so that the baby, somehow gets some sort of radiation, making it even more of a high risk for them to develop any abnormalities.
On the behavioral side, maternal behaviors such as drug and alcohol abuse during pregnancy have been strongly linked to an increase of risk of birth defects. According to the National Institute on Drug Abuse, the harmful use of substances leads to various effects such as diarrhea, hyperreflexes, tachypnea, and as well as seizures, greatly affecting expectant mothers and increasing the risk of defects. These factors highlight the complex interplay between genetic elements and external influences on fetal development.
Addressing these multifaceted challenges requires a holistic approach. Potential solutions include enhancing health education initiatives to raise awareness about prenatal care and risk factors.
Firstly, setting up awareness campaigns that can reach beyond national borders and gauge the interest of public and private organizations to fund solutions would spark both short and long-term changes. Virtual posts, fundraisers, or even community events would all engage individuals to help solve this issue collectively.
Secondly, making these remote communities self-sufficient promotes both independence and self-growth in the long term. Just as you shouldn't give a man a fish but teach a man how to fish, setting up health education camps to raise awareness on the impacts that genetic screening and behavioral factors have on pregnancy would be viable in efforts for the future generation so they know what they're up against and know how to treat their bodies when they're pregnant.
Additionally, enforcing environmental regulations, such as even the most simple activities, including the reduction of CO2 emissions through implementation of more renewable sources in poorer countries, providing safer and purified water through natural or artificial means, and even engaging the government to help support cleanup risks of radiation exposure. It is very difficult to change an entire environment, which is why it's much more feasible to reduce what we can through daily living to prevent accidents and lower prenatal birth defects.
Increasing awareness of the benefits and advantages that maternal immunizations have, including the Tdap, MMR, hepatitis vaccine, among these communities would further equip them with the immunity to these diseases and foster healthier pregnancies. To parallel this, in the journey of raising revenue through government aid and private proceeds, investment towards research in this field is crucial, not only catalyzing in a search to find a more reliable and effective solution to solve defects in pregnancies, but to also raise better awareness on the topic through published papers and release of solutions.
Finally, there's a critical need to invest in genetic counseling to help families understand their risks and make informed decisions. These counselors would provide support for both the family and the patient in this fearful process. Similarly, establishing support services for expected mothers coping with birth defects are also crucial for providing holistic care and improving outcomes.
Tackling the issue of birth defects requires a concerted effort of multiple fronts, improving access to diagnostics, addressing environmental and behavioral risk factors, and ensuring adequate support and education for families, gauging interests of private and public organizations to help with the cause through awareness campaigns and publicity is a necessity to fund these solutions. By prioritizing these efforts globally, we can work towards reducing the prevalence of preventable birth defects and improving the lives of millions of children and families across the world.
These are the references for the sources and images used throughout the presentation.
Finally, we would like to thank the GHLC team for making this possible, our families who gave us the plethora of support throughout the creation of our presentation, and finally, you guys, our audience, for listening to our solutions and our problem. Thank you.
Thank you.